in the Poughkeepsie Library for facilitating this. This is maybe my 30th time doing this in the last couple of months. So it's really something that I enjoy doing. I enjoy bringing this knowledge, this information to people, to the community. Obviously, high blood pressure is one of about 11 different topics that I speak on. More popular is the COVID-19 and immune health presentation. But prior to COVID, I think my most popular presentation was diabetes and sugar, because those two go hand in hand. So it is my privilege to be speaking on this. I think high blood pressure is relevant because about half of all US adults, have high blood pressure, and not everybody is treating it or, or even aware that they have high blood pressure. So it's called the silent killer for a reason. Now I'm going to go ahead and begin sharing my screen. So let's begin. I want to thank you guys for taking the time and being here, by the way. Okay, can everybody see my screen?
Can see it.
Okay, good. Thank you so much. All right, so let's begin. So a little bit about us. So I'm Dr. Cedrick Batchateu. We have a company called Cedrick Wellness Resources, where we provide virtual health and wellness services. Virtual because of social distancing. Unfortunately, we can't be face to face. So we have to do the next best thing. Our mission is to promote better health. And so we do this by offering seminars such as this one, doing medication therapy management, health and wellness consultations, just elevating people's wellness and health and their understanding of their bodies. Now, about me, I attended Albany College of Pharmacy. I graduated in 2013 with my doctorate of pharmacy. And for the last 7 years, I've been doing this on the side in addition to my full-time job. I have been working with different organizations, churches, libraries, community organizations, the why, to bring what I consider wellness seminars. So what we do is we take the importance of nutrition and combine it with scientific facts and scientific knowledge, and that's what I consider to be wellness, with an emphasis on lifestyle changes. I've been speaking for about 6 or 7 years now. To date, we have 11 different topics. If you were interested in learning a little bit more, I encourage you to visit us online. That's drced.com. So that's enough about me. So let's begin. Today, we're going to talk about high blood pressure. This is very relevant. As I stated earlier, half of all US adults struggle with high blood pressure. Not everybody knows that they are hypertensive. Hence, this is why this is often called the silent killer. Many a times you don't know that there was something going on with your heart until you have a heart attack, unfortunately. So this topic is very relevant. We're going to cover the heart, look at high blood pressure itself, hypertension, and then talk a little bit about some complications, and then we'll switch to what are some solutions and preventative lifestyle modifications that we can do. By the way, I would ask that if anybody has any questions, please type them in the chat box. At the end of all of this, we're going to go through all of them. I do set aside 30 minutes to answer any and all of your questions. So please don't think that I'm not going to address or there won't be enough time. There usually is. So I want to thank you all again. Let's begin. So when we talk about high blood pressure, we have to talk about the heart, because the heart is probably the key factor or the key organ when it comes to hypertension. What we're talking about is really when your blood pressure increases to unhealthy or higher than normal levels. This is due to the amount of blood that is flowing through your arteries and your veins. And so the measure of that is called pressure. Now, the heart itself, the average size of the heart is the size of your fist as an adult. It weighs less than a pound. Now, this little thing, this little fist-sized or shaped organ actually packs a punch. It beats about 115 times a day. If you ever put your ears to someone's chest, you're going to hear thum, 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 or as we call it in the medical community, the lub-dub sound. Now, that's really due to the valves opening. You know, you have your atria and ventricles. And so as they open, as these chambers open and close and blood is flowing through, you know, it's the opening and the closing of these valves that makes that noise. Now, each day, your heart pumps about 2,000 gallons of blood. Okay, it's actually controlled by this electrical system. It controls the rhythm, right? The heart is actually electrical, which is evidenced by the fact that it can actually work outside of the body. And pacemakers can be used to stimulate the heart. If anybody's familiar with them, that's when one is put in to sort of give it a jolt. Okay, so the heart is actually very similar to an electrical machine. Now, interesting thing about the heart is that your heart cells are always working. However, they tend to stop dividing. This is one of the reasons why cancer of the heart tends to be so rare. Cancer is often defined by the rapidly dividing cell and its uncontrollable division. And but because heart cells tend to stop dividing, it doesn't leave much room for cancer. So that's a very interesting factor about the heart. Now, having said that, here's what happens when our heart beats, the flow of blood. I want to bring your attention to the illustration on the right. What you see is a series of arrows, blue and red. Now, the blue arrows represent deoxygenated blood. That is blood that has yet to receive oxygen. And the red arrows represent oxygenated blood, hence why they are red. You can think of oxygen as the molecule that gives your blood its color, its red color. Now, what generally happens is the heart pumps the blood to the lungs. And the lungs is where the site of oxygen and carbon dioxide exchange takes place. Okay, so the fact that you and I breathe is what oxygenates our blood. And in exchange for the oxygen that we receive, our body or our lungs, we breathe out CO2. Interesting relationship that we share with nature or with plants. Plants rely on carbon dioxide and they produce oxygen. Humans breathe oxygen and we release carbon dioxide, otherwise known as CO2. So we give nature, we give plants what they need to survive, and they give us what we need to survive. So that's a very interesting thing. Now, it is the oxygenated blood that gets to travel around the body and gets to touch and interact with every cell. In addition to providing the cells with oxygen, they also provide the cells with nutrients, otherwise known as food, okay? And again, the respiratory or the lungs is where the exchange of waste product takes place. Again, carbon dioxide and ammonia being the waste products and oxygen being what we receive in exchange. Now, again, keep in mind, you and I do not tell our hearts to beat. It's autonomous, which means we don't even have to think about it. The heart is very much like a pacemaker, okay? It has these electrical impulses, okay, that force it to contract. Now, this is where electrolytes come in. Electrolytes conduct electricity. Now, what we're talking about sodium, calcium, potassium, chloride, phosphate, and even magnesium. these electrolytes are actually crucial or important for the proper functioning of our heart and its rhythm. Any imbalance in them can throw our heart rhythm or a heartbeat off track and contribute to what we call arrhythmias or irregular heartbeats. Now, here's what happens. We have in our bodies this interstate highway or interbody highway system known as arteries and veins. Arteries typically transport blood away from the heart. Now, this is blood that has been oxygenated. So you can imagine the red arrow, okay? The arteries transport the blood away from the heart throughout the rest of your body. Now, as the blood interacts with cells throughout your body and gets rid of the nutrients and even the oxygen and picks up the waste, that blood gets dumped into our veins. Now, the veins will tend to be bigger than the arteries. And these veins are like tunnels, okay, where the deoxygenated blood and even the waste products get dumped in, and the waste goes right back towards the heart, which shunts it towards the lungs to be exchanged for more oxygen. So think about this huge transport network. Think of it like an interstate highway system, okay? Now, within this highway system, much like ours, you're going to find very different molecules. You're going to find things like oxygen molecules. You're going to find nutrients. You're going to find water. You're going to find cells. You're going to find bacteria. You're going to find, immunoglobulin. You're going to find a myriad of different things. Okay, now very much like our interstate highway, if you were to look, you would find police cars, ambulance trucks, fire trucks, taxis, motorcycles, no bicycles, but you would find all sorts of different vehicles traveling the highway system. Okay, and that's how I want you to think about your arteries and your veins. It's very much like a highway system connecting every part of your body to the heart. Now, this is especially important for the immune system. The body requires a very good transportation system in order to be able to move troops or white blood cells or immunoglobulin to the site of infection. This is very important. Now, the problem, what we call high blood pressure, otherwise known as tension, the problem comes when the highway gets crowded. You can imagine, for example, a California highway, those 8-lane highways where when there's a traffic jam and you see, thousands of cars just bumper to bumper honking at each other, hoping that the pathway will get clear and they'll be able to move on about their day. Well, I want you to think about that for an illustration of what seems to happen with high blood pressure. Okay, because it is the blood content or the blood volume that determines the amount of pressure. Okay, the veins and the arteries, they can stretch a little, they can expand a little to accommodate the volume or the pressure that's going through. But we take advantage of this and we measure that blood pressure, or we measure that traffic jam, if you will, and we call it pressure. And so we use a blood pressure monitor. And it tells us how much pressure is currently present in our veins and our arteries. Now, just to give you an idea of what happens, just with a show of hands, by the way, how many of you are familiar with, the systolic and diastolic number? Just a show of hands, how many of you? Okay, so you're looking at a top number over a bottom number. So the systolic number is considered the top number. Now, I do want to pause here. I believe Susan raised a hand. I saw a sign that
I just was saying, yes, I understand.
Oh, okay. Excellent. Thank you. Thank you. Thank you for all those who raised their hands. So the top number is called the systolic number, and the bottom number is called the diastolic. Okay. Now we measure we use these values to measure the extent of the force that's going through these arteries, okay? And we use a unit of measurement called millimeters of mercury, okay? So the top number, otherwise known as the systolic number, tells us the amount of pressure as the heart contracts or as the heart pumps, okay? And the bottom number, otherwise known as the diastolic number, tells us the amount of pressure as the heart relaxes, okay? So the heart contracts and it relaxes. That's a heartbeat, contracts and it relaxes. So the top number is the contraction, the contracting force, and the bottom number is the relaxing tension or the relaxing force. Now, of course, that means the top number is going to be higher than the bottom number, okay? Now, the American Heart Association, they recommend that the most accurate way to measure your blood pressure is not always what you think. It's not always going to the doctors and getting your blood pressure read. The most accurate way, or the most, one of the best ways to get an accurate value of your blood pressure is to do it at home. And what they recommend is that you sit still, back straight, upper arm at heart level, and the middle cuff rests directly above the elbow. Okay. Now, prior to that, what you want to do, you want to avoid exercise, you want to avoid caffeine or even smoking. Caffeine, for example, can cause your heart to beat a little faster. Exercise will make your heart beat a little faster, and cigarette smoke will alter your values as well. So they recommend doing it ideally, taking or measuring your blood pressure at home. Now, why is that ideal? We're going to take a look at what tends to happen to many people when they go inside a doctor's office and they measure their blood pressure. It's not always an accurate. It's not always an accurate answer. Now, if I can draw your attention to the image on the right, we see that normal blood pressure readings, when we think of normal blood pressure readings, we think of 120 over 80, 120 over 80. Well, truth be told, those values can change. We have what's called hypotension, which means a low blood pressure, which is really, it happens, but for the most part, I think we encounter much more so hypertension, which is high blood pressure. So as you can see, values ranging from 120 to 129 would be considered elevated. 130 to 139 would be considered stage 1 hypertension. A stage 2 hypertension is 140 over 140 and above, and anything above 180 for a systolic value would be considered a hypertensive crisis. And they would suggest that you go and see your doctor or go to the emergency room immediately. And again, much the same, we have diastolic values that change with each category. 60 and below, hypotension or low blood pressure. 61 to about 80 would be considered normal. 80 to 89 would be considered stage 1. 90 and above would be considered stage 2. And anything above 120 for the systolic or the bottom number would be considered a hypertensive crisis. So again, they would encourage you all to go and see the doctor. Now, what causes hypertension? Well, there are actually two categories of causes that we attribute to causing high blood pressure. The first thing we're talking about is primary hypertension. This is the kind that develops over time, and it's really maybe due to lifestyle and genetic factors in your environment, and just maybe your job and your stress level. But what we're talking about is I want to focus on is secondary hypertension. Now, this is hypertension that will manifest due to another disease. For example, chronic kidney disease or kidney disease contributes to high blood pressure because it affects your, it affects your heart, because your kidneys are linked to your heart. or at least they filter the blood that is pumped by your heart. Now, high blood pressure can also be due to sleep apnea, hormonal imbalances, such as from your thyroid and your adrenal, can contribute to high blood pressure, and even certain medications have side effects that can increase your blood pressure. So the secondary hypertension is caused due to another thing. Hypertension or high blood pressure is the result of another issue going on. And again, primary is something that develops over time due to your genetics, due to your lifestyle, due to your diet, maybe due to your, your weight would categorize it as secondary hypertension. Now, one of the reasons why the American Heart Association and many other organizations would encourage you to take your blood pressure at home as a more accurate way to get accurate readings is due to something called white coat syndrome. Now, just with a show of hands, how many people have ever heard of white coat syndrome? Okay, excellent, excellent, thank you. So white coat syndrome. Now, I'm going to ask you, what are your thoughts? Does anyone care to share what they believe white coat syndrome is? Or what have you heard about it? Go ahead, Susan.
You are stressed when you're going to go see the doctor because you're afraid he's going to tell you that there's something wrong with you. So you come in and you already are of a mindset that's stressing you out. You also sometimes rush to get there, or you're late for your appointment. So a lot of things can happen that put you where your blood pressure is not going to be at a comfortable resting place.
Excellent, well said. I couldn't have said it better myself. I think Susan can take over from me.
You can use it in your next lecture.
Thank you, thank you. No, but that was very well said. White coat syndrome is really defined by anxiety, okay, being anxious. As many of you know, anytime that you're anxious, your heart rate or rhythm changes. And so not everybody feels comfortable being in a doctor's office. Not everybody feels comfortable being in a hospital. And so because your anxiety has risen, the values that you get when you're getting your blood pressure reading is not always the same. You're not relaxed, okay? And so those values don't accurately reflect what your day-to-day blood pressure levels are. Okay, now I can share something with you. When I was younger, I hated hospitals, clinics, because I had a fear of needles. Okay, so anytime I had to go to the doctors, I just tensed up because I thought I was getting another shot. But of course, if you were to measure my blood pressure, you would see that it was elevated. But that would not be an accurate reflection of my day-to-day blood pressure. So this is actually responsible for 1 in 3 Americans being misdiagnosed as having high blood pressure. Okay, because they tend to measure it in these clinical settings and they find that it's elevated, and they'll say, hey, Susan or Sue or Nancy, you have high blood pressure, when it's not blood pressure, it's actually anxiety. Now, what are symptoms affiliated with blood pressure? Now, we know high blood pressure or hypertension is known as the silent killer. Well, that's because unlike many other diseases where you will often see the symptoms manifest, many a time someone with high blood pressure will not know that they have high blood pressure until they measure or until something like a heart attack or a stroke happens. So it's called the silent killer because by the time some sort of health event happens, by the time they figure out that they've had high blood pressure all along, it may be too late, hence silent killer. Now, what we have to understand is if you can think back to that highway system, the veins and the arteries that we alluded to earlier, with the different vehicles or the different molecules and cells flowing through your arteries and your veins, too much traffic jam can eventually damage your vessels and your organs. Okay, so too much or elevated blood pressure over a long period of time can begin to damage your vessels, your arteries, your veins, and even your organs. Okay, and this means that it's going to affect these organs that are waiting to receive the oxygen or the blood flow. So organs such as your eyes, your kidneys, even the heart itself, your brain, all of these things get damaged with uncontrolled hypertension. Okay, now complications can include things such as a heart attack, a stroke, brain aneurysm, loss of vision, chronic kidney disease. All of these organs, their function is explicitly linked to their ability to receive proper blood flow. Any interruption of them receiving that blood flow can lead to another health issue or another health disease. Now, of course, we mentioned earlier that a hypertensive crisis is if you are experiencing blood pressure readings of 180 and above. Now, you may have fluid in the lungs that may just lead to a stroke. So what they recommend, the American Heart Association, or even your doctor would recommend, is if you ever see your blood pressure readings get that high, get yourself to the emergency room immediately, okay? Because you are likely going to experience some form of stroke. But when it comes to typical symptoms of blood pressure, what we're talking about feelings of anxiety. A headache might be another sign. Constantly being tired despite resting, dizziness, and chest pain. Now, the dizziness and chest pain are leaning more so towards the hypertensive crisis. So when you get to the point, or if you get to the point where you're experiencing symptoms of dizziness and chest pain, you're likely up there in terms of blood pressure. And it's important to see a doctor or go to the emergency room quickly. Now, when we look at hypertension nationally in the United States, what do we see? We see, or according to statistics, that almost half, that's about 45% of all US adults have high blood pressure. That amounts to about 108 million people. Now, 1 in 3, in addition to the 45%, 1 in 3 adults have something called pre-hypertension, which means that it's not quite high enough to be considered stage 1, okay, which is 130 and above, but it is, which is 140 and above, but it is trending up there, okay? So many adults are trending up there in terms of high blood pressure, and many of them don't know it. That's why checking your blood pressure is crucial to maintaining your health. Now, 1 in 4 properly have the condition under control. That's about 25% of the 108 million Americans. They have their blood pressure under control. Now, that could be through taking of medications or active lifestyle changes. Okay, so currently about 30 million Americans are taking medications for high blood pressure. Now, what's scary about it is that 1 in 5, that's about 20 million adults, okay, they are completely unaware that they have high blood pressure. And because they are unaware, they are not doing anything. Now that's scary, okay? So 1 in 5, or 20% of American adults with high blood pressure don't know they have high blood pressure, or they are not doing anything to treat it, to address it, whether in terms of medications or active lifestyle changes, eating different, okay, or a heart healthy diet. Now, what does that mean? It means that each year, nearly 500,000 people die due to heart-related diseases or heart-related illnesses in this country. To the cost of high blood pressure especially untreated high blood pressure, to this nation is the sum of about $131 billion. So there is a huge cost, okay? And so it's crucial that prevention be our goal, be our aim, and that prevention comes with education. You have to know what's going on in order to take the appropriate steps. Now, take a look at the map of the country to the right, please. I want you to take a look at that map. Keep in mind that the darker the red, the more prevalent high blood pressure is. And the lighter the color, the less prevalent high blood pressure is. So it looks like New York State, we seem to be doing okay. Okay. New Jersey, however, seems to be in the red, not quite dark red. We're looking at several of those southern states are dark red. Now, I'd like to ask the audience this. What are your thoughts about this map? Why do you suppose that those southern states have a greater prevalence of hypertension as compared to, let's say, New York or California? What are some of your thoughts, Susan?
I believe that it has to do with, these are states with Black and brown populations, that these are states that have lower socioeconomic backgrounds, that people's diets, these could be food deserts in these areas because of the population being not as economically successful, so that their whole lifestyle doesn't lend itself to controlling hypertension, and they probably are not getting enough medical care. There probably aren't enough clinics who are treating people. There are probably a lot of people on Medicaid. It's a very complex issue.
Very well said. Very well said.
I'm teaching next week.
You're more than welcome to. You're more than welcome to. I'd like to be an audience member under your seminars. No, very well put. What about what about the culture? Is the culture different down south than it is up north? Because I've presented this seminar before, and to other groups, and I've heard people say, the diet is different. That maybe they drive a little more than we do. They don't walk as much. So I've never been to most of those southern states, so I don't know. But what are your experiences? Do you think there is a cultural difference between us, New York and, let's say, Louisiana?
Yes, there is. I think that there is. I think that there's more fried foods. I think that there's more use of salt. Louisiana has a very strong culture where in fact, I was there just a year ago before all of this. Alcohol is very prevalent in the evening. People love to go out and drink and relax after work. I don't know how many gyms they have. Are people working out? Are people walking? My guess is that this is probably a yuppie thing to exercise or a white thing to exercise. So I think that there are big cultural differences between the North and the South. And I also think that the South is a lot of people are very independent. They don't want people telling them what to do. And probably because of the lower standards of education, probably don't read about everything that comes out in the New York Times that tells them how to manage their health. That we probably, in this little group here, probably have read lots of different things and have become educated on our own.
Very well said. Very well said. I mean, what's interesting is I have a diabetes seminar that I present, and I share a map of the prevalence of diabetes in the United States. And I tell you this, the map is identical to what we're seeing with this map. So it seems to me that these states, have a similar hypertensive prevalence, but the diabetes map is almost identical to this. So it's not just hypertension. Sue, you had something you wanted to say?
Oh, my friend in his 40s had a mild stroke. He was hypertensive. And when he went on a very restricted diet, he, and then developed diabetes. He went on a restrictive diet for diabetes, was very careful about his hypertension, but when he went on the diet for diabetes, he did not need medication for hypertension anymore. There's apparently a correlation between diabetes and hypertension. I'm not sure what, but they both are heart related in some ways.
Excellent point, Sue. Excellent point. So there's a quote by Hippocrates, that says, "Let food be thy medicine."
Mm.
I don't know if you've ever heard of that.
Yeah.
Food, or the diet choices that we make, directly impacts our health. Okay, it directly plays a role on our health. So the diet that we hold, the food cultures that we cherish, is reflection. It reflects our health. And I do want to say this, you bring up a good point as far as the relationship between diabetes and high blood pressure. Now, it has to do with blood. Okay, diabetes is the excess presence of sugar in the blood. And high blood pressure is the tension that is found in the blood flow. And so this is what happens. Imagine if you had a bottle of water and then you added sugar, okay? It would eventually become thicker, okay? It becomes thicker and syrupy, okay? Now that thick and syrupy water does not flow as easily as plain water. So as you can imagine, if you have sugar in your blood, it becomes a little thicker in consistency. And so your heart has a harder time pumping or pushing that blood. So the heart's pressure has to increase, okay? So the blood pressure is gonna go up because of the extra presence of sugar in the blood. Does that give you a good analogy?
Yeah.
Okay, so I want you to, hopefully Deborah can have us come back and present on diabetes. I believe I focused on that a little bit more. But yeah, I wanted again, thank you for sharing that story. We're gonna touch a little bit about the power of food to radically lower our blood pressures, the power of nutrition, the power of lifestyle change. We're gonna touch upon that in the upcoming slides. So thank you for sharing that point, Sue. All right. Now, let's make this a little bit, let's play a game, okay? Now, we have 3 different groups. We're going to evaluate based on age, based on gender, and based on racial or ethnic lines. Now, I want to know, what are your thoughts on these age groups? Now, the first are the elderly, as defined by 60 and above, and the youth as defined by 59 and below. Okay, let's say young adults versus their elders, let's say. Okay, which of those 2 groups of people would you say has a higher prevalence of high blood pressure?
The older ones.
The older one. Does anyone think that the younger ones have a higher prevalence?
I put younger.
The younger? Okay, well, let's see.
60 plus.
Younger.
Okay, so here we find that it is the older ones. It is the older ones who have a higher prevalence.
Oh.
Okay, now if we go back to what I mentioned as being primary hypertension or primary causes of high blood pressure. Okay, so we see that primary hypertension or essential hypertension is hypertension that develops over time as a result of, our lifestyles of, the foods that we ate, the stresses that we bear. It's no different than a brand new car versus a car with some wear and tear on it, which is more likely to break down first. It's the older car because it's driven more. It's hit a lot more bumps along the roads. Okay. So because of the life that has been lived and the stresses that have been endured and the choices that have been made in terms of lifestyle and the foods that have been consumed, okay, we find that, the toll of life will be more manifest in those who are older. So, but good guess, everyone. Now, let's look at the gender role, okay, between men and women, male or female.
Female.
Which of those two groups would you say has a higher prevalence of high blood pressure?
The women do.
Who?
The women do.
The women?
Yes.
Anybody think men have a higher rate of blood pressure?
I think it's men.
Now, why do you think that, Nancy?
I guess in terms of stereotype, I thought it was always the men that had the higher hypertension, higher rates of heart disease. So I guess I thought it was all related. Now, I will say that woman looks a lot bigger than me. So is she overweight? Is that, your message there?
No. When you get these images on Google or on the internet, in an effort to differentiate, they try to make it seem like she's wearing a dress or, the equivalent of a trapezoid of sorts. So, that wasn't me. If the pink, if the pink color could not give it away, then, hopefully her dress, it's a dress. She's a skinny woman. So, all right, let's go and see. Let's see. Okay. So it's actually about
the same.
It's about the same. Women lead a little bit more. I don't know why. Is it more stress? Is it that they're more stressed? What are your thoughts? Does anyone have anything? Any idea?
I think that when women go through menopause, they have a tendency to put on weight, which is just not all women, but a lot of women do. And also the hormone changes. And I think that you lose some of those protections when you get older. And I think genetics play a part in that, but I think that your gender contributes to that.
Very well put. Very well put. Oh yeah. Oh, no. Now let's go back. Now let's take a look at the ethnic groups. Now this only applies to those in the United States. Okay, we're not talking about people in Africa or people in Asia or people in Latin America. We're talking about those ethnic groups as found in these United States. Now, before us, we have 4 different ethnic groups. We've got whites or Caucasian Americans. We've got Black or Black Americans. We've got Hispanic or Hispanic Americans. And the other really was a way, let's say Asian Americans, right? Because that's where I took the statistics, but I wanted to be a little bit inclusive. So I just called it others. So with that being said, of those 4 ethnic groups, who do you suppose has the highest rate or prevalence of high blood pressure?
Blacks.
Blacks.
Okay. All right. Followed by who? Who do you suppose is next?
Other.
Other, the Asians?
No, I thought it was Black and Hispanic.
Yes. I agree.
Okay. So I'm trying to get a hierarchy. Are you saying Blacks have the highest, followed by Hispanics? Okay. Now who would be third in that scenario?
Native American.
So would that fall under other?
I guess.
Well, I to be fair, I did not include Native Americans. I included Asian Americans. So let's think of others as Asian Americans.
You have 2 groups there. You have Chinese and you have South Indian.
Yeah,
And
I lumped them
Indians
together.
have a high rate of hypertension. well, they have a high rate of diabetes, I know.
Okay. Okay.
Yeah.
So you're saying, so let me get this straight. You're saying Blacks have the highest, followed by Hispanics, followed by the other category, and then lastly, Caucasian Americans?
Mhm.
Okay. Does everyone sort of agree? There's no wrong answer, by the way. You know, these are just guesses. I have the answers. So, all right. So let's see. Let's see. All right. So about 45% of Black American adults have some form or level of high blood pressure. And this is followed by about 32% of whites. 32% of whites. Hispanics are doing a little better at about 29.5% of their adults have high blood pressure. And lastly, the Asian Americans, 18%.
Interesting.
Yeah, now we find a similar pattern with, you know, my diabetes presentation, but also with my, I believe it's the obesity presentation. So it's similar, not exact, but it's similar. Now, why do you suppose that things are like this? Does anyone have any input or thoughts?
The supposition about Black, I mean, I don't know how much it's genetics or what, but supposition about Blacks is that living in this world, the stress levels are very high, which contributes to hypertension.
That's true. That's true. I've heard those. What's interesting is when they test or when they compare Africans living in America, so those who came over first generation, the statistics are not the same between Black Americans and Africans American, you know, the real Africans.
Yeah.
Yeah, so there is a difference. Yes, Susan.
So we're back to food, and food, fried foods, foods that are high in salt, which was very common staple in the South, with salted pork and your fried chicken that's salted. And lack of activity has developed into obesity, which goes hand in hand with your diabetes and your high blood pressure. So you've got a time bomb with this particular group of people, where and it's our American lifestyle. We're sedentary. It's easier to go to McDonald's or Kentucky Fried Chicken than it is to go to the food bank and pick up the fresh fruits and vegetables that the Poughkeepsie Farm Project has put out there, and have to cook. In fact, I can tell you that when we have cooked at our soup kitchen at the partnership, and we've gotten vegetables from the farm, people don't eat them because they're not familiar with them. They don't want them. They want the fast, easy, high caloric foods, and that the vegetables have absolutely no interest, and it gets thrown out. And so that has to be some form of education to teach people that these foods are good for you, and they can be made in a tasty way. You should try it. It's like teaching your children, well, just give it a taste and see, maybe you'll like it.
Wow, and that's really sad. You know, it goes to show how much of an education people really need. No, and you're right. You're right. You know, I see that with a lot of young people in this generation. You know, they grew up in sort of a fast food era. They grew up in a time when, you know, you don't actually see a cucumber. It comes to you cooked, right? So when they see the raw form of a vegetable, you know, or it doesn't look perfectly, you know, it's not a perfectly shaped vegetable or fruit, you know, it sort of turns them off. But the nutritional value or the nutritional content of food, you know, is overlooked, unfortunately. But, you know, excellent point, Susan. Excellent point. All right, let's continue. All right, so how do you test for high blood pressure? Well, there are several things that, your doctor does, or that, you can do in order to identify whether you have elevated blood pressure. So one of the first things that they can do a urinalysis. And what this will do is they can test for things within your urine that will reflect the level of stress that your heart is going through. Now, of course, to measure, to measure your heart and the values that are going there, many of you may have already experienced this, but doctors will usually conduct a lipid panel, a blood lipid panel, to see just, your risk, to evaluate your risk of your arteries being clogged. Generally, having artery, cholesterol excessively deposited out along your arteries puts you at a greater risk of elevated blood pressure. You can think of it as, imagine pushing blood through a narrower corridor, so the heart has to push a little harder. Obviously, you can just get a blood pressure cuff, and from the comfort of your home, can measure your blood pressure. But what we're looking at really medical or clinical interventions that can give you insight into what's going on internally or inside of you. Now, there's also the EKG. Now, what this does is it measures it looks at the heart rhythm. And what this does is it gives your physician, or it gives the patient a look at the rate, the rhythm of the heart. Really, that EKG, the different patterns that it produces, because sometimes if there's something going on, the patterns will vary. The patterns that it produces gives us an insight into what's going on inside of the heart. So these patterns can be indicative of maybe, a rhythm problem, maybe an arrhythmia that's manifesting, maybe heart failure. And of course, we know, and as we've seen in many shows and many movies, when it flatlines, it means the heart has really stopped beating. But the EKG itself, electrocardiogram, is reflective of what is going on inside of the heart, whether there's some sort of, illness forming, or something is about to happen. So it really gives us a picture of what you and I cannot see. Now, what are some complications? Earlier, we touched upon how the heart's ability to pump blood to all the organs within the body is crucial, because these organs require that blood flow, uninterrupted blood flow, in order to do their jobs. What happens if, for example, say your eyes do not receive proper blood flow? Okay, it doesn't receive proper oxygen, it doesn't receive proper nutrition. Well, like anything that is being starved or deprived of nutrients, it will start to malfunction and ultimately die. What we're talking about is retinopathy. What that means is the retina, which is the tissue layer that's responsible for converting light into nerve signal. So essentially, it allows us to see and interpret the images that our eyes receive and make sense of them. In the condition of hypertension, the blood vessels that lead to the eyes or to the retina can become damaged, which means the flow of blood gets restricted, it gets interrupted. Now, of course, this means that the retina over time receives less and less blood flow and less nutrients. So its ability to convert light into nerve signal gets decreased over time. Okay, now this is one of the more common hypertensive symptoms. So I don't know if you've ever gone to your optometrist and said, "Hey, doc, my vision seems to be dimming, or it's not what it used to be." I believe they're trained enough to recognize that any sudden change in your vision may be linked to your heart or blood flow. And so some symptoms of this, of retinopathy, include reduced vision, maybe some swelling around your eyes, bursting of blood vessels, so which will give you, you'll see red spots or specks of redness or blood, along your eyes, and double vision. Okay, so it's very important to get regular eye exams. Obviously, you want to eat a diet high in fruits and vegetables. You want to get those nutrients, because those nutrients that we get delivered to every organ and every cell in the body. Okay, and they need it to function properly. Now, of course, we come down to the kidneys. Now, the kidneys are responsible for filtering blood. So every ounce of blood that is pumped or pushed through by the heart will eventually make its way to the kidneys. Now, the kidneys are responsible for filtering them, which means removing waste from that blood and pushing the blood back into bodily function. Now, in the case where the kidneys are not receiving proper blood flow, okay, or the blood flow to the kidneys have been damaged, okay, their ability to filter the waste from our blood gets decreased, okay? And so what this leads to over time is a gradual buildup of toxicity in the human body, okay? Over time, kidney function begins to decline. Now, this can lead to chronic kidney disease, okay? Now, symptoms of this, or that something is going on, include fatigue, you're always tired, nausea or vomiting. Your body reacts violently to smells or things that you once commonly ate. The body just wants to get rid of it, because the body understands that, hey, your kidneys that normally filter out some of the bad things that you eat, some of the bad things that you drink, well, they're not working as well. And so in order to prevent you from putting something unhealthy inside of you, the body's going to force you to throw it up or regurgitate it. Okay, and we also see that swelling of your arms or swelling of your legs, with the excess buildup of fluid, otherwise known as edema, will be a sign or a symptom that there's something going on with your kidneys. And so one of the ways you can really ameliorate this issue is to reduce your consumption of sodium, proteins, potassium, and even phosphorus. Because remember, even though these minerals are crucial, these electrolytes are crucial for the heart to function properly, when their levels get so excessive, the kidneys will actually get rid of some. The kidneys will filter the blood and get rid of anything you have in excess that you no longer need, okay? But if the kidneys are not working well, then it becomes your responsibility to eat foods that are low in sodium, reduce your protein intake, phosphorus intake, your potassium intake. Now, one way to alleviate the stress and pressure on your body is really to lose weight. And if it gets to stage 4, stage 5 chronic kidney disease, this is where the process called dialysis will be required of you. Now, I want you to look at the image on the right. As you can see, dialysis is a process where a machine will actually replace the function of your dying or failing kidneys. So essentially, part of the blood is taken out of your body and goes to this machine that has a dialyzer, which will filter the blood. And as it filters the blood is then returned back into the body in order to continue its functions throughout the body. So the machine is replacing the normal kidney functions that you normally have. So be good to your kidneys and be mindful of what you eat. Now, of course, one of the worst symptoms or complications of high blood pressure or elevated and uncontrolled blood pressure is having a stroke. Now, essentially, having a stroke is essentially the blood flow to certain parts of your brain being completely stopped due to, plaque being lodged in an artery and blocking flow. Now, you can imagine a sumo wrestler, for example, okay? Imagine, a sumo wrestler standing along your kitchen door. You know, you're trying to force your way in, but he's big and wide, and he won't let you in. Now, as we stated before, high blood pressure or uncontrolled high blood pressure will eventually damage your artery walls. Okay, the pressure and the friction, okay, that is due to the high volume going through such a narrow tube can eventually cause tears on your wall. And this restricts blood flow. Now, cholesterol is produced by your liver. Okay, this is something that I love to emphasize, because a lot of people think that cholesterol only comes from food. Only about 25% of your cholesterol comes from your food. The majority of the cholesterol in our bodies comes from our liver. The body produces it. Now, cholesterol is deposited along damaged artery walls in order to fix the tear. Okay, cholesterol is not necessarily a bad thing. It acts like a Band-Aid. It's only deposited to fix the tear that has resulted from the excessive pressure. Okay, it stops internal bleeding. Now, what happens is over time, as the tear continues and more cholesterol gets deposited, it starts to become cumbersome. It starts to block, you know, the arterial pathway, and blood seems to have very difficult time flowing through. So that's one of the unintended consequences of cholesterol deposition, is that over time, its Band-Aid effect just gets bigger and bigger, and ultimately can block blood flow. Now, the blockage can lead to an embolism, a heart attack, or even a stroke, depending on where the blockage takes place. Now, some symptoms or some signs that you're having a stroke, there's an acronym called FAST, F-A-S-T. The F is for your face is drooping. The A is your arms are weak. The S is you're having speech difficulty. And the T stands for time to call 911. So if you're ever talking to a friend and you notice that their face is drooping, or you know, their arm, they don't have control of their arm, they can't lift it up like they normally would, or they're slurring their speech, you know, it may be that they're having a stroke. Okay, and heart failure can ultimately result from all of this excess heart pumping. And as with a stroke, you know, time is crucial. So if you or someone were to experience any of these symptoms, you know, call 911 immediately. The sooner you act, the more you can rescue. Now, with high blood pressure and considering the times of COVID that we're going through, you know, another complication is that, you know, high blood pressure, especially if it's uncontrolled, puts you at greater risk of succumbing to COVID infections. Now, a recent study of patients with COVID illness found that those with high blood pressure had a twofold increase in the risk of death. Okay, what they found was simply this: untreated hypertension increased your risk of death. So if you had two patients, both of whom tested positive for COVID and both of whom were hospitalized for the coronavirus, one patient did not have high blood pressure, the other patient had high blood pressure. The patient who did not have the high blood pressure is more likely to recover, okay? Because it's one less issue that the body has to deal with. Now, according to the CDC, there are several risk factors for severe COVID-19 illness. What that means is if you have any or multiple of these risk factors, you're at an even greater risk of succumbing to a severe COVID-19 illness. So these risk factors include advanced age, cancer, chronic kidney disease, coronary artery disease, heart failure, hypertension, obesity, sickle cell, type 2 diabetes, and a weakened immune system or compromised immune system. This could be something like AIDS or HIV. Did someone have any, I think I heard someone say something. Oh, okay. So with all of this, with everything that's been said, I know it seems a little gloomy, but let's look at, the good news, okay? Typically, if you have high blood pressure, what your doctor will do is they'll likely put you on some sort of medication. There are different categories. Now, this can be decided by your doctor. They look at certain factors. What medication may work for one, may not work for another. So they have to look at, your past, your gender, your history. They've got to look at all those factors and before prescribing anything. But just to give you a brief overview, you have beta blockers. They're medications that end with the letter LOL, alls, such as atenolol, metoprolol. These are medications that will make the heart beat slower with less force. Then you have the diuretics class, furosemide, IDE is the ending. These are water pill, so they help the body get rid of excess sodium, and then water will move into the urine. You have ACE inhibitors, such as lisinopril, PRIL. These block angiotensin, which causes your vessels to tighten. So they help relax your arterial vessels and sort of reduce the pressure. You have angiotensin receptor blockers, such as losartan. They tend to have that sartan ending. Again, it blocks angiotensin, which is the hormone that causes constriction of vessels. You have calcium channel blockers, such as amlodipine. These things block calcium. Remember, calcium is one of those electrolytes that helps the heart contract. It blocks calcium from entering the heart and results in less forceful heartbeats. And then you have alpha-2 agonists, such as prazosin, doxazosin is another one. These change the nerve impulses that make your blood vessels tighten. So most of these medications help to relax your arterial, your arteries and your veins in order to help facilitate the flow of blood. Now, of course, right now, with everything that's been happening, especially due to the pandemic, because this also plays a role in the, especially for those who have high blood pressure. Due to COVID-19, this last year, we've had, just a really rough 2020. We've had stress due to the elections. For those who are in school, and many people who are working, a lot of students aren't going to school like they should. I know parents are stressed because normally they would go to work knowing that their children were in school, but now many schools had to close and go virtually. A lot of people have had to be furloughed or altogether laid off because of the shutdowns. All of this has culminated in unprecedented levels of stress. 2020, to say the least, was a very stressful year. Then on top of that, you have isolation. Due to the shutdowns and the lockdowns, we weren't able to socialize and fellowship with our friends, with our families. A lot of people weren't able to see their parents in nursing homes. This contributes to a worsening mental health crisis. It also contributes to heavier alcohol consumption because people are stuck indoors. It also contributes to sedentary lifestyle. Gyms, were closed 1 month, open the next, only to close again. So people were not as active as they normally were, as they normally would be. Of course, given the shutdowns, a lot of people were afraid to go outside or go running. So what does that mean? It means that life this past year was really drastically impacted. For example, for those who are used to seeing their doctors, periodically or even yearly, a lot of Americans were afraid to go see doctors or were afraid of hospitals altogether because they felt that, if I go, I come into contact with many people, many of whom are sick. And so if any of them has, the virus, or, and I come in contact with them, I might get it. So a lot of people actually missed their doctor's appointment. And so it affected compliance. For many people who are taking medications, a lot of them, did not get the proper follow-up. Okay. And so now the trend is for people to rely on telemedicine. But for a while, people didn't know what to do. They simply didn't go and see their doctors. And so for many other people, they missed their medications altogether. So 2020 was a very stressful year. Okay. And so this contributed to a worsening health crisis. So it's not simply about the virus, it's about all the other types of chronic illnesses, including high blood pressure. Okay, so I think we come out of this in worse shape than we entered 2020. And so I just wanted to share that with you all, because it's something that, we're going to deal with for the next couple of years. The consequences of coronavirus are more than just a virus, but it spills over into other conditions. Now, what can you do? Again, whether you're taking prescription medications or not, one of the most important things you can do if you are concerned about your heart health is to have a blood pressure monitor, something at home. Again, because a lot of people are not going to the doctors or are not going to the hospitals, and of course, because of white coat syndrome, the anxiety that comes from being in a clinical setting, it is strongly encouraged for you to learn to measure your blood pressure at home. These days, it's actually a lot easier than before, only because you can simply attach the cuffs just above your elbow and push a button. And in about 10 seconds, these machines are very accurate now. They'll give you your blood pressure reading. So one of the advantages of having a personal blood pressure monitor is that you reduce the white coat syndrome of anxiety. You're more relaxed at home. They're very accurate. Okay, you're not relying on a doctor squeezing, the little ball and listening to your chest. They're very accurate there. It's less dependent on human error. You can take multiple readings to be certain. You can take 2 or 3 times and just sort of get the average to get an even clearer picture. Okay, and of course, according to the American Heart Association, it's good to sit upright, back straight, upper arm at heart level, the middle of the cuff rest above your elbow. And you don't want to exercise. You don't want to consume any caffeine. You don't want any nicotine for at least 30 minutes prior to, so you can get more accurate readings. So let's conclude with what we've touched upon. So for anyone who is struggling with high blood pressure, what are some things that you need to do in order to give yourself healthier outlook? Well, in terms of lifestyle, you want to move at least 30 minutes a day, because physical exercise gets your blood flowing. Okay, it's also cleansing. You want to identify your stress triggers. As I mentioned a little earlier, 2020 was a very stressful year. What you don't want is to compound all of that stress. You want to minimize any stress that comes into your life. You want to lose weight because, believe it or not, obesity contributes to the worsening of any health crisis. It contributes to the worsening performance of your kidneys, contributes to your blood sugar metabolism. It contributes to the heart's ability to pump blood throughout the body. So weight loss should be a goal. And above all things, you want to make sure that you're sleeping properly. Okay? What you don't want to do is be sedentary, which means you're sitting on the couch or a couch potato. Okay? Now, of course, with the shutdowns that we've experienced, we've had to stay at home. Many people haven't had the ability to go out like they normally would. Gyms are closed. You're not able to see your friends. So we've had to be less social. We haven't been able to see our families like we normally would. But it's important that even though you're staying at home. You know, it's important to go out, even around in front of your house, walk a little bit, stretch, let the sun get some sunshine. Okay. You want to avoid nicotine and, of course, alcohol. Okay. In terms of nutrition, it's important to have high fiber dense foods. Okay. These are plant-based foods usually. You want foods that are high in the essential fatty acids. Now, if you can't get those food products, the very least you can do is to supplement your diet. Supplements make sure that whatever you don't get from the diet you currently hold or you currently have, at least you'll be able to get those essential nutrients, those vitamins, those minerals, those essential fatty acids from a different source. We can't all eat from whole foods and we can't all eat healthy all the time, but at least with supplementing, you're making sure that those things that you're not getting from your diet, you're getting from another source. Okay, and you want to focus on minerals because we've touched upon how these electrolytes, most of which are minerals, are crucial for the proper functioning of your heart. And if you ever take too much, have faith, your kidneys will filter the blood and remove any excess that you do not need. I would strongly encourage you to consider adding healthy fats into your diet. So we're talking about avocados, coconuts or coconut oil, and there's even clarified butter called ghee. I think that's how you say it. It's a very healthy product, okay? You want to add nuts, seeds, legumes to your food or to your diet, lean meats, poultry, fish, garlic, coenzyme Q10 is really good for the heart, magnesium as well, something that's good for the heart. So these are just some minerals, some nutrients that are good for a proper heart function. Now, of course, if you want to talk to me outside, if you want my personal recommendations, I would love to do that. Now, what you want to avoid in terms of nutrition, you want to avoid things like canned foods due to the excess preservatives that are added in there. You want to avoid high sodium containing products. You want to avoid or rather reduce processed foods, trans fats, such as that which is found in fried foods, okay? Things that, were fried in lards, sugar or sugary products, you want to reduce those. Now, interestingly enough, there's something called, an air fryer, which is really good. It doesn't use as much oil, but you still get the same crunchy, crispy result. It's a much healthier alternative. So we've come to the end of the presentation. I want to thank you all for sitting through and joining us today. I certainly want to thank Debbie or Deborah for facilitating this because it's been an amazing opportunity. I want to thank the Poughkeepsie Library, especially Tom, for just setting up this whole Zoom platform and for me coming. I wanted to share with you that on our website, we do have a total of 11 different speaking topics. This one was hypertension. So if you're interested in any of the other ones, especially the COVID-19 one, please let Debbie or Deborah know so that they can request me again. We do offer services in terms of health coaching. If you wanted to sit down with me virtually and go over, your health, and I would love to do that, or even medication therapy management. That's something else that I do, considering I'm a pharmacist. So we can go over your medications and see, if there are duplicates or if there's something in terms of adverse effects that we can address. Now, I would ask everyone this one favor on my website, and I'm going to post a link in the chat. Please take 30 seconds and go and give me a feedback of what you thought about this presentation.